It's my feel-good breakfast show.
Yes, it is, and it is a Tuesday morning. Thank you so much for choosing to start the day off with us. Now, we all know that our kidneys are among some of the most important organs in our entire body, but I don't think we all really understand what their function is. Well, this week is Kidney Health Awareness Week, and so we have called on our trusted friend in medicine, Dr. Darren Green, to unpack what these organs are all about, shaped like red beans. Dr. Darren Green, good morning. Good morning, senor.
Morning, doctor. Do they really look like beans like we're seeing here?
They do indeed. The shape is typically like the shape of a kidney bean.
And where are they located on the body? Like, I think a lot of people don't know where they're located on the body.
Yeah, so they're the size of a fist. Your fist, look at your fist, and then just under the rib cage, next to the spine on each side. So, yeah, just under at your back. But that's how high up they are. A lot of people think when they're getting really lower back pain that the kidneys, my kidneys are hurting. But it's actually quite high up, just under the rib cage. So, yeah.
Okay, so that's where they are. And now that we know where they are, and we do say that they are among the most vital organs in our entire body, what exactly is their function?
Well, their job is multifaceted, from filtering blood and getting rid of things like toxins and unwanted drugs that we take, for example, whether that be recreational drugs and clearance, or whether that be medication that we're using. The byproducts need to be excreted. So obviously that, as well as filtering the blood to regulate things like your electrolyte balance. Your electrolytes are things like sodium, potassium, your salt content. All very important when we're looking at how much water is kept back in the body and how much water we let go of, which can affect then the blood volume and your blood pressure in turn. So you must understand the function is vital in regulating blood pressure, obviously in filtering out toxins, but also looking at the immune system, producing red blood cells, the hormones that control, obviously producing red cells like erythropoietin. Remember the ones, EPO, the cyclists that cheat by getting EPO infusions and transfusions.
Right, yes.
To produce more red cells so they can carry more oxygen and exercise better. So that's also part of the kidneys. And then, of course, they're also involved with hormones in terms of regulating good bone health through vitamin D and cholecalciferol as well. So they've got quite a few functions.
They're very important. Sure. Well, with all those functions you just mentioned, that also naturally means they're more susceptible to problems. What are some of the issues with the kidneys, if we can put it that way?
So if you take their primary function, which is to filter blood, you can imagine the things that affect them are things where the blood supply to the kidney needs to be in check and intact. So does the blood volume. You need to have enough pressure in the system, pushing blood there all the time, so that enough arrives at the kidney to filter in the first place. So that's important. Along with that, obviously, things that affect the kidney would be things that can affect the filters, block the filters or damage the filters. There's a host of cells, about 1 million to 2 million per kidney, called nephrons, specialized cells. And if you roll out the amount of tubes that they have and join them back to back, it would span 16 kilometers, to give you an idea.
In each kidney?
That's how tightly those tubes are packed. That filters, obviously, the blood, and then obviously allows urine to pass at the end as the end product. So it's a really fine mesh that I'm talking about here. And you get 2 million nephrons per kidney. So it's quite magnificent how compact and how important it actually is.
So your blood actually travels quite a long way before it actually gets through your entire body.
I mean, exactly. And the rate, obviously, that it's filled 180 liters a day. That's what those babies filter every single day, so that you can be free of toxins and so that you can regulate your electrolytes and fluid balance better.
And you can survive on one as a human being, which is even more extraordinary.
That's incredible. We'll talk about that
very shortly when we return again with our Medical Tuesday chat with Dr. Darren Green. It is Kidney Health Awareness Week.
It's my feel-good breakfast show.
Welcome back. We are chatting to Dr. Darren Green because it is Kidney Health Awareness Week. We're taking your calls with questions about kidney health on 0214309881.
Now, Dr. Darren Green, before we all start getting paranoid about our kidneys, I mean, they play a very important role in the body. What are some of the symptoms we need to look out for should your kidneys start to get problems?
Yes, so I think because you produce urine, so alterations in what your normal urine production is, and your body can produce between 1 liter and 2 liters of urine a day, by the way. So understanding that you either produce no urine and you're consuming enough fluid, that water's going somewhere. Something's not going right
Okay.
with the filtration process. Then, of course, you can swell from holding back and retaining too much fluid. Your eyes can become puffy, and so can your face as well. You can then have long-term development due to the red cells. You can have anemia as well, which is an iron shortage, and your immunity can be compromised. Swelling of the feet and ankles as also part of the fluid balance issues. And then if you have things that cause your electrolytes to be deranged, like, if you get a high potassium count, for example, that can affect your heart rhythm and even get rhythm disturbances. So generally people are feeling tired, they're feeling swollen, they're feeling bloated. And a simple urine test that can demonstrate, for example, the leakage of protein into the urine can be quite useful.
Yeah, and this is exactly why kidneys are so important to our bodies, because once something goes wrong with them, so many other things go wrong in terms of the
100%.
symptoms you mentioned. But fortunately, these are treatable.
Yes. So a lot of the causes of kidney disease are reversible. One of the big ones is dehydration. Someone that does an endurance event, for example, is sweating a lot, they're losing a lot of fluid, they're not replacing the fluid, their kidneys are like raisins, they're craving, they're dry, they need the fluid, obviously. And if that happens, obviously, you could cause then what's called pre-renal failure, where the volume of blood going to the kidneys is not enough. And also, if you don't have sufficient water in the blood component, the kidneys can get damaged. When you take certain medications, they can also damage the kidneys chemically. Anti-inflammatories that we use for a bit of muscle pain and back pain, taken in the absence of enough water and fluid, cause significant damage to the kidneys and can actually cause permanent damage for all those athletes and sportsmen out there that pop pills regularly for pain and a niggle and a joint pain, especially our marathon and endurance cyclists.
Sure. That's quite scary.
Yeah.
Now, when it comes to kidney failure, what's the treatment for that?
Sure, so you basically have three options. Hemodialysis, where you have an artificial kidney as a machine outside the body, where your blood is relayed through that machine and then pumped back into you. Hemodialysis, peritoneal dialysis, which works on the same principle, obviously, slight differences. And then, of course, a transplant, which is so difficult due to the amount of people that actually need organs to be donated in terms of transplants in our country.
Yeah. We were talking just during the break now about, if it serves such an important function, how are we as human beings able to survive with one kidney?
That's a great question. I know a lot of family members end up, because of the typing and the match and the tissue match, donating a kidney to someone that otherwise wouldn't be able to live. And the truth is, you can survive on one kidney, provided the one kidney has at least 75% of its function. So you can imagine, when you have one kidney, you have to look after that kidney.
Yeah.
And if you lose more than 25%, your body can cope up to a certain rate with filtering the whole body's blood with one kidney, because the specialized cells that I mentioned, the nephrons, they can swell up and become quite large and then handle the increased volume that the other kidney can't anymore.
Yeah.
And that can happen to compensate unto a point. So we need to look after them.
We certainly do. Well, we've got a caller on the line, Louis from Pretoria. Good morning, Louis. What's your comment or question for Dr. Darren Green?
Dr. Darren Green, good morning, Doctor. It's Louis speaking here. I just wanted to find out why did the disease of my son, he had a hemochromatosis, and they had too much iron in the blood, which the kidneys could not control.
Yeah, what was he asking?
So
Why?
what was your question, Louis? Sorry?
The question was that my son died of the disease called hemochromatosis.
Oh, yes.
He had too much iron in the blood,
Yeah.
Okay.
Yes.
and the kidneys could not control that.
Okay.
100%. So hemochromatosis, often a disease that they talk about in many movies, is a storage disease. Like you get diseases where your body has excess storage of things like copper. In this case, it's iron.
Okay.
And iron can be deposited in different organs and build up with toxic effects, obviously damaging the cell. So when it comes to the kidney and those beautiful cells I spoke about, if iron obviously is collecting in the kidney and blocking those filters and leading to damage of those filters, you can imagine you have long-term effects. The problem with hemochromatosis, obviously, is it needs to be detected quite early, and often certain chemical agents are given to try and bind the iron and remove it from the body, and that can only happen until a certain point. So really tough disease, and I'm sorry to hear about your loss, but thank you for making people aware that hemochromatosis also can contribute to kidney disease.
All right. Well, we're going to keep our lines open, 0214309881, as we continue our Medical Tuesday chat with Dr. Darren Green about Kidney Health Awareness Week.
It's my feel good breakfast show.
Welcome back to your Feel Good Breakfast Show. You're just in time as we continue our health chat with Dr. Darren Green. It's Kidney Health Awareness Week. So naturally, if you have a comment or a question about the kidneys, we'd love to hear from you. That number is 021 430 9881.
We were actually asking a very trivial but perhaps interesting question, if you will, that if the kidney is the size of your fist, and
Yes.
let's say you and I are brothers,
Yes.
we have differently sized fists.
I hear you.
Does that mean I could most probably donate a kidney to you? Like if we're matching, can you take my size kidney?
Yes, I can, definitely. Yeah. It's not about the size of the kidney. As long as there's space to house the kidney
Yes.
when they transplant it, it's more about the tissue typing and the match,
Okay.
you know, so you don't get rejected. So they look at a few issues for any organ transplant.
Very interesting. Well, Dr. Darren Green, we have Anonymous on the line that's got a comment or a question. Good morning, Anonymous.
Good morning, and how are you all in Cape Town?
Very
we are
well,
good.
thank you.
What's your comment or question
Morning.
for Dr. Darren Green?
I've been diagnosed about 4 years ago. I couldn't go to the toilet and pass water. And I was told I've got a paralyzed bladder. It's called atonic bladder. And I've got to do self-catheterization. And I'd like to know, can this be reversed? Can something be done about it?
Great
So that I
question.
can go normally to the toilet.
Thank you very
Thank
much.
you for
Anonymous.
sharing that.
Thank you.
Self-catheterization
Okay.
is tough. So in order that you don't explode from urine retention, and also that you don't have leakage at untimely, events, it's important to understand. It's a really tough thing to do, and it can be quite painful. It increases your risk of bladder infections. So I understand why she's asking the question.
Okay.
It all depends on exactly what the cause is of her bladder being atonic, or the nerve supply to the bladder. You get a condition called a neurogenic bladder, which is related, obviously, to the nerve supply of the bladder. And the nerves control the gateway. They control the toll gate at the end of the bladder, which are the muscle layers. And the one muscle layer needs to relax, and the other one actually needs to contract
Okay.
in order to facilitate voiding of the bladder. And that is under the influence of the nerve supply to the bladder. But those things can be affected by spinal cord lesions of the spine, lower back problems. They can be affected by things like toxins or other systemic diseases. Even TB can cause that kind of problem. So it would depend what's causing, obviously, the bladder's tone to be affected by the nerve supply, whether it can be reversed or not. But I'm sure she's consulted a good urologist, who are the people that specialize in this specific condition, that will advise, what they've looked for that's reversible already or not.
Okay. Well, Anonymous, thank you for
Thank
that
you for
call.
calling.
And our lines do remain open. It's 021 430 9881. Quickly, Dr. Darren Green, when it comes to the flow of blood into the kidneys,
Yes.
is it true that there flows more blood into the kidneys than into the heart and the brain?
Yeah, so yes, there is a large amount. I think I mentioned the volume as being 180 litres per day.
Per day.
And it's also got to do with the vital function that the kidney has in terms of it. But, you must understand that it needs to filter that blood so the blood can go back to the heart.
Yeah.
So the heart is obviously very important as the distributor of this blood.
All right, okay, we'll keep our lines open once again, 02143098881, and when we come back, we'll have Dr. Darren Green share some tips on how to keep those kidneys
Yes.
healthy, especially if you still have good working ones.